And then what we'll do is we'll apply the actions at the synovial joints of our body to the respective planes that they belong in. So what I'm going to use this piece of paper, and I'm going to use this pen from the standpoint, the paper is going to represent my plane. The pen will represent the axis of rotation that we'll talk about that's associated with each of the planes. If we look at, okay, this plane, okay, this paper as a plane, think of taking the plane, okay, through the belly button, the sternum, the chin, and the nose. If we take that plane and divide our body, okay, into a left and to a right, all right, we are going to refer to that as the sagittal plane. Now that is the cardinal plane or mid-sagittal plane. We could also take this plane or plate of glass and we could drive it through the shoulder joint and bring it out the back side of the shoulder joint. And if so, what we would have is just the left arm on one side of this plane and the rest of the body, including the right arm, on the opposite side of the plane. So a sagittal plane doesn't have to be in the middle, dividing this equally into left and to right. It can be off-center, so to speak. Now, associated with the sagittal plane, this pen is going to represent an axis. An axis. An axis in this case, which is the frontal axis, goes from the side to the other side. So it goes right through the plane, the sagittal plane, at right angles or perpendicular to it. So frontal axis, sagittal plane. Now, what we know, okay, is that if we're referring to a movement that's called flexion, this is flexion of the shoulder joint, extension of the shoulder joint, they are occurring in a sagittal plane around a frontal axis. Actually, any flexion of the elbow extension, flexion, extension of the wrist, flexion, extension of the trunk, all of them occur in a sagittal plane and around a frontal axis. So keep that in mind. Flexion, extension, any joint that does that, sagittal plane, frontal axis. Well, let's look at another plane. I'm going to take this as my plate of glass, and I'm going to imagine driving this through my greater trochanter, my acromion process, my ear. And so what happens, I take this plate of glass, go through the right hip and right area I mentioned, and pull it all the way through to the left side. And so what then we have an anterior part and we have a posterior part that is in front of or behind this plane. Frontal plane has a sagittal axis. So remember, axis is always going to be at right angles. So we go right through from front, so to speak, to back. That axis is going to go through that plane. So frontal plane, sagittal axis at right angles. Anything that is a side-to-side movement. So I'm trying to demonstrate this is shoulder joint abduction and hip abduction and adduction. So shoulder joint and hip abduction and shoulder joint and hip adduction in the frontal plane. Therefore, those movements occur around this sagittal axis. Others that are representative of frontal plane movements. If we take the trunk and we do, I'm a little teapot, short and stout, here's my handle, here's my spout, tip me over, pour me out. This is lateral flexion or lateral bend. I can go to the right and I can go to the left. So these movements at the trunk, lateral flexion or lateral bend, occur in a frontal plane. They're side-to-side movements. Side-to-side movements. The other thing, of course, I can do the same movement at my head. So lateral bend to the right and left. Okay, and then the other thing is, right, we can take our fingers from an anatomical position, or we can take our wrist and we can move the fingers into abduction and adduction, or the wrist into ab and adduction. And those movements as well are occurring in the frontal plane around the sagittal axis. The last of the three planes, I'm going to take this plate of glass, piece of paper, I'm going to cut myself right in the middle, around belt level. Okay, I could cut myself here and cut myself so I have a little bit of a stump of thighs. I could cut myself like a guillotine, cut my head off. All right, but either way, I've got a what we call horizontal or transverse plane. Now, you can probably imagine the axis at right angles is the vertical or longitudinal. It comes from the superior or from the top down through the bottom. So, transverse or horizontal plane, we associate the vertical or longitudinal axis. So all movements that are in the horizontal plane or transverse plane, they occur around this vertical or longitudinal axis. What movements would that be? Any movement that is a rotary, or rotation I should say, would be in this transverse plane. So if I rotate my trunk to the left or rotate my trunk to the right, if I turn my head to the left or turn my head to the right, all rotations occur in, okay, this transverse plane around the vertical axis. If we look at my shoulder joints, if I medially rotate them from the anatomical position, or then I laterally rotate, same thing. If I move my femurs into, or hips, into medial rotation and lateral rotation, that is all in this transverse plane and around the vertical or longitudinal axis. The other pair of movements that we should note, okay, is if I put my arms out in an abducted shoulder joint position, and then I move them toward the extended midline of my body. This is horizontal adduction, AD, and this is sometimes referred to as horizontal flexion, and this is horizontal abduction, going away from that midline that's extended out. So these horizontal abduction and adduction movements would be occurring in, of course, the horizontal or transverse plane, and therefore around a vertical or longitudinal axis. The last one to clear up, okay, make sure of, if we are sitting in this chair, notice that when I put my feet on the floor, my femurs are parallel to the floor. They are basically in a horizontal plane right now. If I do this movement as we commonly do in an adduction machine, this is horizontal abduction, because notice I'm taking my femurs and moving them in that horizontal plane, and horizontal adduction. Horizontal abduction of the femur or hip, horizontal adduction. So those movements, of course, occur at the hips, and they are in that transverse plane and around that longitudinal or vertical axis. So again, memorize planes that go with axes, sagittal and frontal. Sagittal plane, frontal axis, frontal plane, sagittal axis. Horizontal transverse plane, vertical or longitudinal axis. Sagittal plane movements are always flexion, extension of some joint. Frontal plane is always abduction, adduction of some joint. And then the rotations of the trunk or rotations of any joint is going to be referred to as transverse plane movement.